video. When they were putting the law together, the factors driving the discussion were healthcare costs are too high. I think everybody can agree with that. Healthcare costs in the United States are much higher than in other industrialized nations. And we don't get as much value as we should for our healthcare dollar. And too many people are uninsured and or underinsured. This will be an important point later in the discussion of the issue of underinsured, that is. One of the problems with more spending, like we said, is there's a lot of fraud, waste, and abuse in the system. There's also just a lot of paperwork. I don't know if you've ever gotten something that says this is not a bill. Well, this would be an example of something, of the fact that there are nearly 1/3 of healthcare spending in the United States is on administration in our complex system. Medicare, however, runs at a much lower administrative system, but that's because they have much less rules to comply with. Regional variation in spending. And so as in we're spending twice as much in one place as we are in the other. And even though we're spending that much more, you would think that that's going to be, you have much better outcomes. That would be the logical thing you would think of. But what we actually found was the opposite. The more you spent, the worse the outcome. And this is kind of a fundamental problem in the system. A lot of things can contribute to that, and that'll be have to be a point for a future discussion. But that's something important for you to remember. The 3 legs of health policy, we're going to be talking about access mostly in this presentation. How do patients access healthcare in the delivery system? Do we want them going to the emergency room for something minor that could be treated like when you were a kid at the nurse's office, or maybe an urgent care clinic, or telemedicine now, or the pharmacy? That's kind of access. Quality, that is about how reimbursements have changed. They've changed beginning with the Medicare program, which really drives the lead on a lot of health insurance initiatives, in that most private health insurance companies base their reimbursement off what Medicare pays, number one. Number two, they also are shifting to kind of mirror some of the things in Medicare, in that they're shifting to more value-based contracts. All right. You'll have to watch our next video if you want to learn about the legislative process and how that played into all of this. But we're going to talk about some insurance stuff here. Acme Insurance Company. Insurance is actually simple once you understand its complexities, kind of like a lot of the things in all of this. But here's an insurance company in a perfect world. They, as you can see, the green are individuals. There we go. Here's your healthy individuals right here. And those are the people that are kind of a lot of times they're younger, they're paying in on premiums, and people that are active, people that are just generally healthy, that pay their premiums every single month, but really don't go to the doctor or have to take any medications or anything like that. A lot of times they might be single, so like they wouldn't have to worry about children going to the doctor and whatnot. Then you've got some folks with low cost medical conditions, just something minor. Maybe you take a couple medications, something like that. And then you have your high cost medical condition individuals. But what happens is everybody pays the same premium and the costs are shared by all. So essentially, these folks up here that are the high cost medical condition individuals even though the insurance company pays out much more in claims for these individuals, or their claims are at much higher costs than others. And that's really what it really is they might be on a really expensive medication, something like that. These costs are absorbed, and it's, you're able to keep the premiums at a low price. But eventually, and what's happened is when they introduce new mandates in these federal laws, some of the folks who were healthy decided to drop, and that caused the premiums per person to have to go up, because as you can see, there used to be 5 green people. There are actually 4, 2 and 1. Now we got 2, 2 and 1. So there's 50% less, or 100% less. Pretty soon, only sick people have insurance, because same thing happens again. And prior to the ACA, insurance companies would actually respond by not renewing a policy, or not renewing somebody with pre-existing conditions, refusing to insure those with pre-existing conditions, rather, and other things. And that was really one of the fundamental things in the law, was to address those things, those insurance market reforms. All right, this chart, I'm going to do my best John Madden impression. This is a couple years old, and this chart was put out, several years ago, but it's important for you to understand how the Affordable Care Act impacts, or how your income affects in the healthcare.gov, in the ACA marketplace, how your income matters. So we're going to go to here. Boom. Right there. It kind of does a little drawback right there. All right. So this chart was put together as an example, because at the time of the law came out, the employer mandate is an important part of the law. Caused a lot of heartburn for a lot of businesses, forced some businesses to have to offer health insurance when they previously were not. In this chart, and the response by some was, well, we're just going to drop coverage if we don't, we're just not even going to offer. And so this chart was put out to kind of show them this is how an employee would be impacted should you do that. And it's important because every employee, and it depends on the industry, but they all have different, wages. So from 100 to 133, now it's 38%, 138% of the federal poverty level. These people are eligible for Medicaid. Yeah, you get it. All right. And that's going to be a whole nother lesson, the issue of Medicaid and how that all played out over the last decade. But this is important because there's a lot of folks that were eligible for Medicaid and still are eligible for Medicaid, but they're not enrolled. That's a big problem that they have with federal programs. We've got, and some states decided to not expand Medicaid. So we'll get into that in depth in the future. But anybody that's in this area, maybe you're, have a small business and have a lot of deductions, can get down there. Maybe you work in the service industry, don't make high wages, part-time work. These individuals are eligible for Medicaid. From here to here, they are eligible for both ACA subsidies and cost-sharing assistance, which means that their deductibles are much lower. So if your income is around this range and up, it's better for you to go to the ACA marketplace in general. All right. From 250 to 400%, they get subsidies, but no cost sharing assistance. So that's subsidies and cost sharing. And then from here down, they get nothing. So in 2016, an individual who made more than 40, so anybody that's making, any employee that's making over around 50,000, it's better for them probably to have an employee plan. As you can see, these are called the perverse incentives. So essentially, as a person's income goes up, the value of the ACA marketplace goes down if they're healthy, unless they have a pre-existing condition, or then that's really their only option. Insurance companies did a lot of things after the ACA was passed, and it really all culminated in 2017 when they responded by pulling out of the market. Some of them merged together. So then and decided to not enter certain markets. So these ones in the red over here, they had 0 carriers at one point. The markets have since stabilized. But in general, exchange policies include more limitations on networks. Is something that is really important. These issues right here are things that you need to be aware of. The 3 things that I would recommend that you ask yourself as you're going into this is, what network, how often do I utilize healthcare services? Making sure that the doctor that you have is in network. So it doesn't hurt to give their office a call before you choose, just to make sure. Thinking about whether you're going to travel or not. Things like that are some important questions. In the employer marketplace, this is where most folks receive coverage, and a lot of small businesses have been hit hard. They got really large rate increases for many years. So this is the time of year to be looking at those things. And if your organization, or if you know somebody that is needing somebody to look at some of these things, why don't you go ahead and give them our information.
I can't take this anymore. My company just got a letter from the IRS about Obamacare, and I don't know what it means. It's so confusing with compliance, changes in health insurance, managing employees. It's just too much.
Call Sean McGuire at E.D. Bellis.
Who?
Sean McGuire. He created a company called E.D. Bellis to help people just like you.
But it sounds expensive.
It's a fraction of the penalties you might pay. The people at E.D. Bellis are always trying to find ways to save money and have services for companies of any size.
Call Sean McGuire at E.D. Bellis at 402-884-9020. He'll find a way for your company to save thousands on healthcare and prescription drugs, as well as compliance costs. Your first consultation is free. Call Sean McGuire at E.D. Bellis, 402-884-9020. 402-884-9020. At E.D. Bellis, they'll help you solve the problem.